So you touched a little bit on puberty blockers there. What are puberty blockers? When do you access them? What are they used for?
Yeah. So puberty blockers are used for the children that are coming out, usually before the age of 16, because 16 is when you can start gender affirming hormones, um, like things like estrogen or testosterone. It doesn't mean you have to again at 16, but that is when they become available to people. So some people do stay on puberty blockers longer than 16. Um, but really, what they do is allow what's been described as a pause for puberty. So, wherever the point is that you're at in puberty, it will stop you at that point. And so, for instance, if you're a trans masc, you may not want further breast development, or if you're trans femme, you may not want more of an Adam's apple or your jawline to keep developing in that way. And so it kind of gives people the chance to then just halt that and then decide, do I want hormones? Do I want to be, maybe not on hormones? Where do I want to go? Um, yeah, there's a lot of rubbish on the internet about them, so you do have to be very careful around internet searches. And I really recommend families have a look at the Aotearoa transgender health guidelines if they're going to look, because it's specific to our context, and the information you get there will be a fact rather than somebody's opinion or overlaid with other interests that people might have. Parents worry about them because they worry about long-term effects, and it's pretty clear at this stage that it's really only bone density that is potentially a problem later on, but again can be managed. So I talk about that in detail with families before they go on puberty blockers, but really the things that they can do are support your child to get out in the sunshine and have some exercise, which is going to be great for your mental health anyway. And they can ask their GP or be offered vitamin D is another way of doing that. And obviously, if you're only on it for a short time, so I would say it's pretty common to see 14 and 15-year-olds, they're only going to be on puberty blockers for a year or so often, and so really there'd be very small chance of there being a poor bone density outcome, so the thickness of their bone is unlikely to be affected later on in life. It's not then, it's later on that they're worried about. And really, other than that, that's that's one of the things to think about. But and then in terms of side effects, we talk through those as well, and they tend to be things like just being a bit irritable when you first start on them because you're suddenly losing hormones, and we all know that changes in hormones cause changes in lots of things, and one of those can be kind of mood and irritability, but that settles pretty quickly, and most people feel really positive that they're doing kind of the right thing, so those two things get a little bit kind of balanced out. Between those, hot flushes can be really common for everyone, and that's again because we're switching off hormones really quickly, but they're nothing like a menopausal woman's hot flushes. They're not severe and they won't get in the way of learning or sleep or that kind of thing. I think, you need to have a really good discussion with your GP or with a paediatric endocrinologist, whoever you end up seeing around this, and you'll get given written information and some good resources to have a look at. But yeah, so some kids then stop those and then just choose not to be on anything, and many kids then go on to take whichever gender affirming hormone they'd like to take, like estrogen or testosterone. Yeah.
So if a young person starts puberty blockers quite early in their puberty, then what does that mean for their fertility later in life?
Yeah. So remember I said earlier that they're kind of reversible. So when you stop, basically you start your puberty exactly where you stopped. So in theory, if you stop puberty blockers, you will go on to have whatever fertility you would have had before. So it won't affect your puberty and your fertility, and it doesn't really matter when you started on them. However, if you start puberty blockers and at an early age, so early in puberty, let's say 12, 13, and then you don't stop them and you go straight on to gender affirming hormones, you haven't really developed the ability to have children at that stage, so fully developed, egg capacity or sperm production. And so in theory, you then may not be able, your fertility may be affected. Look, there are so many bits to this story that you almost have to go and talk about your individual child at that time, because there's so many different little avenues. But I think it's fair to say that parents are concerned about fertility. But really, I'm not going to go into all of the details about what you can do, but there are things that can be done, and it will be something that you would have a really in-depth talk with your GP or paediatric endocrinologist about before you started puberty blockers. And some children are old enough, for instance, to get sperm preservation, and so they will go on puberty blockers having banked sperm, and so at some point in the future they may choose to use that in whichever way they would like to use it. But there's a lot of detail around it that your individual child obviously deserves a conversation about where they are and what they're thinking they would want for the future, but just to know that there are options.